75 NCLEX questions, 2026. Question 1. The nurse is taking the health history of a patient being treated for emphysema and chronic bronchitis. After being told the patient has been smoking cigarettes for 30 years, the nurse expects to note which assessment finding? A. Increase in forced vital capacity, FVC. B. A narrowed chest cavity. C. Clubbed fingers. D. An increased risk of cardiac failure. The correct answer is clubbed fingers. Clubbed fingers are a sign of a long-term, or chronic, decrease in oxygen levels associated with COPD. Question 2. The nurse is taking the health history of a 70-year-old patient being treated for a duodenal ulcer. After being told the patient is complaining of epigastric pain, the nurse expects to note which assessment finding? A. Melena. B. Nausea. C. Hernia. D. Hyperthermia. The correct answer is melena. Melena is the finding that there are traces of blood in the stool which presents as black, tarry feces. This is a common manifestation of duodenal ulcers. Question 3. A nurse is providing discharge teaching for a patient with severe gastroesophageal reflux disease. Which of these statements by the patient indicates a need for more teaching? A. I'm going to limit my meals to 2 to 3 per day to reduce acid secretion. B. I'm going to make sure to remain upright after meals and elevate my head when I sleep. C. I won't be drinking tea or coffee or eating chocolate anymore. D. I'm going to start trying to lose some weight. The correct answer is I'm going to limit my meals to 2 to 3 per day to reduce acid secretion. Large meals increase the volume and pressure in the stomach and delay gastric emptying. It is recommended instead to eat 4 to 6 small meals a day. Question 4. The nurse in the emergency room is treating a patient suspected to have a peptic ulcer. On assessing lab results, the nurse finds that the patient's blood pressure is 95/60, pulse is 110 beats per minute, and the patient reports epigastric pain. What is the priority intervention? A. Start a large bore 4 in the patient's arm. B. Ask the patient for a stool sample. C. Prepare to insert an tube. D. Administer intramuscular morphine sulfate as ordered. The correct answer is start a large bore 4 in the patient's arm. The nurse should suspect that the patient is hemorrhaging and will need fluid replacement therapy, which requires a large bore 4. Question 5. A female patient with atrial fibrillation has the following lab results: hemoglobin of 11 g/dl, a platelet count of 150,000, an INR of 2.5, and potassium of 2.7 milliequivalent/L. Which result is critical and should be reported to the physician immediately? A hemoglobin 11 g/dl. B. Platelet of 150,000. C. INR of 2.5. D. Potassium of 2.7 milliequivalent/L. The correct answer is potassium of 2.7 milliequivalent/L. A potassium imbalance, hypokalemia, for a patient with a history of dysrhythmia can be life-threatening and can lead to cardiac distress. Question 6. While receiving normal saline infusions to treat a GI bleed, the nurse notes that the patient's lower legs have become edema too and auscultates crackles in the lungs. What should the nurse do first? A. Stop the saline infusion immediately. B. Notify physician. C. Elevate the patient's legs. D. Continue the infusion, since these are normal findings. The correct answer is stop the saline infusion immediately. The patient has a fluid volume overload as a result of overly rapid fluid replacement. The nurse should stop the infusion and notify the physician. Question 7. The nurse is working in a support group for clients with HIV. Which point is most important for the nurse to stress? A. They must inform household members of their condition. B. They must take their medications exactly as prescribed. C. They must abstain from substance use. D. They must avoid large crowds. The correct answer is they must take their medications exactly as prescribed. Antiretrovirals must be taken exactly as prescribed to prevent drug-resistant strains. Even missed doses can reduce the effectiveness of future treatment. Question 8. A nurse finds a 30-year-old woman experiencing anaphylaxis from a bee sting. Emergency personnel have been called. The nurse notes the woman is breathing but short of breath. Which of the following interventions should the nurse do first? A. Initiate cardiopulmonary resuscitation. B. Check for a pulse. C. Ask the woman if she carries an emergency medical kit. D. Stay with the woman until help comes. The correct answer is ask the woman if she carries an emergency medical kit. Many patients who have a known history of anaphylaxis carry EpiPens. This is the best way to stop a hypersensitivity reaction before it becomes life-threatening. Question 9. A man is prescribed lithium to treat bipolar disorder. The nurse is most concerned about lithium toxicity when he notices which of these assessment findings? A. The patient states he had a manic episode a week ago. B. The patient states he has been having diarrhea every day. C. The patient has a rashy pruritus on his arms and legs. D. The patient presents as severely depressed. The correct answer is the patient states he has been having diarrhea every day. Persistent diarrhea can lead to dehydration, which can increase the risk of lithium toxicity. Question 10. A 65-year-old man is prescribed Flomax, tamsulosin, for benign prostatic hyperplasia. The patient lives in an upstairs apartment. The nurse is most concerned about which side effect of Flomax? A. Hypotension. B. Tachycardia. C. Back pain. D. A difficulty urinating. The correct answer is hypotension. Hypotension can lead to dizziness and a risk for injury to the patient, particularly dangerous for someone living upstairs. Question 11. A man is receiving heparin subcutaneously. The patient has dementia and lives at home with a part-time caretaker. The nurse is most concerned about which side effect of heparin? A. Back pain. B. Fever and chills. C. Risk for bleeding. D. Dizziness. The correct answer is risk for bleeding. A confused patient is at risk for injuring themselves and at risk for hemorrhage should an injury occur while on anticoagulants. Question 12. A female patient is prescribed metformin for glucose control. The patient is on NPO status pending a diagnostic test. The nurse is most concerned about which side effect of metformin? A. Diarrhea and vomiting. B. Dizziness and drowsiness. C. Metallic taste. D. Hypoglycemia. The correct answer is hypoglycemia. The patient is at risk for hypoglycemia because she is on NPO status and continuing to take an antiglycemic drug. Question 13. The nurse is reviewing the lab results of a patient taking lithium for schizoaffective disorder. The lab results show that the blood lithium value is 1.7 mg/L. What would the nurse take as the priority action? A. Induce vomiting. B. Hold the next dose of lithium. C. Administer an antiemetic. D. Give the next dose of lithium. The correct answer is hold the next dose of lithium. Lithium's therapeutic range is 0.5 to 1.5 mg/L. A level of 1.7 mg/L indicates toxicity, so the dose should be held. Question 14. A patient asks the nurse why they must have a heparin injection. What is the nurse's best response? A. Heparin will dissolve clots that you have. B. Heparin will reduce the platelets that make your blood clot. C. Heparin will work better than warfarin. D. Heparin will prevent new clots from developing. The correct answer is heparin will prevent new clots from developing. Heparin is an anticoagulant that prevents new clots from forming or existing clots from growing. It does not dissolve existing clots. Question 15. The nurse is reviewing the lab results of a patient who has presented in the emergency room. The lab results show that the troponin T value is at 5.3 ing/ml. Which of these interventions, if not completed already, would take priority over the others? A. Put the patient in a 90-degree position. B. Check whether the patient is taking diuretics. C. Obtain and attach defibrillator leads. D. Check the patient's last ejection fraction. The correct answer is obtain and attach defibrillator leads. Normal troponin T is 0.2 ing/ml. This patient is having an acute knee. Ventricular fibrillation is a major cause of death in cardiac arrest. Defibrillation leads are priority. Question 16. A nurse is caring for a patient undergoing a stress test on a treadmill. The patient turns to talk to the nurse. Which of these statements would require the most immediate intervention? A. I'm feeling extremely thirsty. I'm going to get some water after this. B. I can feel my heart racing. C. My shoulder and arm is hurting. D. My blood pressure reading is 158/80. The correct answer is my shoulder and arm is hurting. Unilateral arm and shoulder pain is one of the classic symptoms of myocardial ischemia. The stress test should be halted. Question 17. The nurse is reviewing the lab results of a patient who has presented in the emergency room. The lab results show that the BNP, B-type natriuretic peptide, value is a 615 pg/milliliter. What would the nurse take as the priority action? A. Call a cardiac code and implement emergency measures. B. Check the patient's oxygen saturation. C. Inform the physician that the patient has congestive heart failure. D. Encourage the patient to limit activity. The correct answer is check the patient's oxygen saturation. An elevated BNP, greater than 100, indicates decreased cardiac output/CHF. A priority intervention would be to ensure proper oxygenation after an assessment. Question 18. A nurse is caring for a patient after a coronary angiogram. Which of these actions taken by the nursing assistant would most require the nurse's immediate intervention? A. The nursing assistant fills the patient's pitcher with ice-cold drinking water. B. The nursing assistant elevates the head of the bed to 60 degrees for a meal. C. The nursing assistant refills the ice pack laying on the insertion site. D. The nursing assistant places an extra pillow under the patient's head on request. The correct answer is the nursing assistant elevates the head of the bed to 60 degrees for a meal. For 3 to 6 hours after a coronary angiogram, the patient should have their bed no higher than 30 degrees to prevent bleeding at the insertion site. Question 19. A man has been taking lisinopril for CHF. The patient is seen in the emergency room for persistent diarrhea. The nurse is concerned about which side effect of lisinopril? A. Vertigo. B. Hypotension. C. Palpitations. D. Nagging, dry cough. The correct answer is hypotension. The patient is at risk for hypotension due to possible dehydration from fluid loss combined with the antihypertensive medication. Question 20. The nurse is taking the health history of a patient being treated for sickle cell disease. After being told the patient has severe generalized pain, the nurse expects to note which assessment finding? A. Severe and persistent diarrhea. B. Intense pain in the toe. C. Yellow-tinged sclera. D. Headache. The correct answer is yellow-tinged sclera. Jaundice, yellow sclera, is a common clinical finding of sickle cell disease. caused by bilirubin released from damaged or destroyed RBCs. Question 21. A client with multiple sclerosis reports a constant, burning, tingling pain in the shoulders. The nurse anticipates that the physician will order which medication for this type of pain? A. Alprazolam, Xanax, B. Corticosteroid injection, C. Gabapentin, Neurontin, D. Hydrocodone/acetaminophen, Norco. The correct answer is gabapentin, Neurontin. Anticonvulsants like gabapentin are often the first line of treatment for nerve pain associated with MS. Question 22. Which of these clients is likely to receive sublingual morphine? A. A 75-year-old woman in a hospice program. B. A 40-year-old man who just had throat surgery. C. A 20-year-old woman with trigeminal neuralgia. D. A 60-year-old man who has a painful incision. The correct answer is a 75-year-old woman in a hospice program. Sublingual morphine is often used in hospice because patients may be unable to swallow, and for access can be painful or unconducive to palliative care. Question 23. In educating clients on ways to manage pain, which topic can be appropriately delegated to a LPN/LVN who will continue under supervision? A. Acupuncture. B. Guided imagery. C. Alternating rest/activity. D. Over-the-counter medications. The correct answer is alternating rest/activity. Alternating rest/activity is within the nursing scope of practice, safe to use, and a standard treatment appropriate for delegation. Question 24. The nurse assesses a patient suspected of having an asthma attack. Which of the following is a common clinical manifestation of this condition? A. Audible crackles and orthopnea. B. An audible wheeze and use of accessory muscles. C. Audible crackles and use of accessory muscles. D. Audible wheeze and orthopnea. The correct answer is an audible wheeze and use of accessory muscles. Audible wheezing and the use of accessory muscles for breathing are classic signs of an asthma attack. Question 25. The nurse assesses a patient suspected of having meningitis. Which of the following is a common clinical manifestation of this condition? A. A high WBC count and decreased level of consciousness. B. A high WBC count and manic activity. C. A low WBC count and manic activity. D. A low WBC count and decreased level of consciousness. The correct answer is a high WBC count and decreased level of consciousness. Meningitis is usually caused by infection, high WBC, and features increased intracranial pressure, ICP, which presents as decreased lock. Question 26. A patient is being treated in the neurology unit for meningitis. Which of these is a priority assessment for the nurse to make? A. Assess the patient for nuchal rigidity. B. Determine the patient's past exposure to infectious organisms. C. Check the patient's WBC lab values. D. Monitor for increased lethargy and drowsiness. The correct answer is monitor for increased lethargy and drowsiness. Lethargy and drowsiness indicate a decreased level of consciousness, which is a cardinal sign of increased ICP, which can be life-threatening. Question 27. The nurse is caring for clients in the pediatric unit. A 6-year patient is admitted who has second and third degree burns on his arms. The nurse should assign the new patient to which of the following roommates? A. A 4-year-old with sickle cell disease. B. A 12-year-old with chickenpox. C. A 6-year-old undergoing chemotherapy. D. A 7-year-old with a high temperature. The correct answer is a 4-year-old with sickle cell disease. The burn patient is vulnerable to infection. Sickle cell disease is not a communicable disease, making this the safest roommate assignment. Question 28. A patient with meningitis is being treated with vancomycin intravenously 3 times per day. The nurse notes that the urine output during the last 8 hours was 200 ml. What is the nurse's priority action? A. Check the patient's last bun. B. Ask the patient to increase their fluid intake. C. Ask the physician to order a diuretic. D. Notify the physician of this finding. The correct answer is notify the physician of this finding. Vancomycin is nephrotoxic. Low urine output suggests impaired renal perfusion. This serious adverse effect must be reported immediately. Question 29. A patient is being admitted to the ICU with a severe case of encephalitis. Which of these drugs would the nurse not be expected to be prescribed for this condition? A. Acyclovir, Zovirax, B. Mannitol, Osmitrol, C. Lactate ringers. D. Phenytoin, Dilantin. The correct answer is lactate ringers. Lactate ringers is used in fluid replacement, which is contraindicated if a patient is at risk for high ICP. Question 30. The nurse is treating a patient who has Parkinson's disease. Which of these practices would not be included in the care plan? A. Decrease the calorie content of daily meals to avoid weight gain. B. Allow the patient extra time to respond to questions and do ADLS. C. Use thickened liquids in a soft diet. D. Encourage the patient to hold the spoon when eating. The correct answer is decrease the calorie content of daily meals to avoid weight gain. Calorie content should be increased, not decreased, for patients with PD due to calories burned from muscle rigidity and tremors. Question 31. A 45-year-old woman is prescribed ropinirole, Requip, for Parkinson's disease. The patient is living at home with her daughter. The nurse is most concerned about which side effect of ropinirole? A. Slurred speech. B. Sudden dizziness. C. Mask-like facial expression. D. Stooped posture. The correct answer is sudden dizziness. Dizziness and orthostatic hypotension are serious adverse effects of dopamine agonists, increasing fall risk. Question 32. The nurse is taking the health history of a patient being treated for Parkinson's disease. After being told the patient has classic symptoms of Parkinson's, the nurse expects to note which assessment finding? A. Tremors. B. Low urine output. C. Exaggerated arm movements. D. Risk for falls. The correct answer is tremors. Tremors are one of the 4 cardinal signs of PD, along with rigidity, bradykinesia, and postural instability. Question 33. A nurse enters a patient's room and finds them unconscious with a rhythmic jerking of all 4 extremities. The patient is foaming heavily at the mouth. The patient was on seizure precautions and the bed rails are up and padded. What is the nurse's priority action? A. Administer lorazepam, Ativan. B. Turn the patient to his/her side. C. Call the physician. D. Suction the patient. The correct answer is turn the patient to his/her side. Turning the patient to the side will keep the airway open and prevent aspiration, which is the first priority during a seizure. Question 34. A nurse is giving a discharge education to a patient who has been diagnosed with epilepsy. Which of these teachings would she stress the most? A. Avoid doing alcohol and drugs. B. Follow up with the neurologist, physician, or other healthcare provider as prescribed. C. Do not stop taking anticonvulsants, even if seizures have stopped. D. Wear a medical alert bracelet or carry an ID card indicating epilepsy. The correct answer is do not stop taking anticonvulsants, even if seizures have stopped. Stopping anti-epileptic drugs suddenly can cause seizures and increase the chance of status epilepticus. Question 35. The nurse is caring for a patient in the ICU who has had a spinal cord injury. She observes that his last blood pressure was 100/55, and his pulse is 48. These have both trend downwards from the baseline. What should the nurse expect to be the next course of action ordered by the physician? A. Assess the patient for decreased level of consciousness. B. Administer normal saline. C. Insert in tube. D. Connect and read an EKG. The correct answer is administer normal saline. The patient is entering neurogenic shock. Normal saline is used to replace fluid volume to treat hypotension and bradycardia. Question 36. A nurse is caring for a patient who is suspected to have sustained a spinal cord injury. What best describes the overarching principles used to guide the care for this type of condition? A. Immobilize the cervical area to prevent further injury. B. Monitor the patient's level of consciousness to prevent neurologic deterioration. C. Help the patient with activities of daily living and provide emotional and physical support. D. Facilitate tissue perfusion to the spinal cord while maintaining airway and breathing. The correct answer is facilitate tissue perfusion to the spinal cord while maintaining airway and breathing. Maintaining airway, breathing, and circulation guides the overall plan of care to prevent secondary injury to the spinal cord. Question 37. A 23-year-old woman is admitted to the infusion clinic after a multiple sclerosis exacerbation. The physician orders methylprednisolone infusions, Solomedrol. The nurse would expect which of the following outcomes after administration of this medication? A. Decrease in muscle spasticity and involuntary movements. B. A slowed progression of multiple sclerosis-related plaques. C. A decrease in the length of the exacerbation. D. A stabilization of mood and sleep. The correct answer is A. Decrease in the length of the exacerbation. Methylprednisolone infusions are the first line of treatment during an acute exacerbation to decrease the length and severity of a relapse. Question 38. A nurse knows that which of these patients are at greatest risk for a stroke? A. 60-year-old male who weighs 270 pounds, has atrial fibrillation, and has had a TIA in the past. B. 75-year-old male who has frequent migraines, drinks a glass of wine every day, and is Hispanic. C. 40-year-old female who has high cholesterol and uses oral contraceptives. D. A 65-year-old female who is African American, has sickle cell disease and smokes cigarettes. The correct answer is A. 60-year-old male who weighs 270 pounds, has atrial fibrillation, and has had a TIA in the past. This patient has multiple significant risk factors: obesity, atrial fibrillation, and a history of transient ischemic attack, TIA. Question 39. A nurse frequently treats patients in the 72-hour period after a stroke has occurred. The nurse would be most concerned about which of these assessment findings? A. High NR is 3 seconds long. B. Heart rate is 110 beats per minute. C. Intracranial pressure is 22 mm/Hg. D. Blood pressure is 140/80. The correct answer is intracranial pressure is 22 mm/Hg. ICP peaks around 72 hours post-stroke due to edema. A level of 22 mm/Hg is high, target 20, and dangerous. Question 40. A nurse is caring for a patient scheduled to have cataract surgery. The patient asks why they developed cataracts and how they can prevent it from happening again. What is the nurse's best response? A. Age is the biggest factor contributing to cataracts. B. Unprotected exposure to UV lights can cause cataracts. C. Age, eye injury, corticosteroids, and unprotected sunlight exposure are contributing factors to cataracts. D. Unfortunately, there is really nothing you can do to prevent cataracts, but they are amongst the most easily treated eye conditions. The correct answer is H. Eye injury, corticosteroids, and unprotected sunlight exposure are contributing factors to cataracts. This response covers the most common contributing factors, including those that are preventable. Question 41. A nurse is educating a patient about bimatoprost, Lumigan, eye drops for the treatment of glaucoma. Which of the following indicates that the patient has a correct understanding of the expected outcomes following treatment? A. I should be experiencing less blurriness in my central field of vision. B. This medication won't help my vision at all, but will keep it from getting worse. C. My peripheral vision should be increasing back to its normal state, but will take a few weeks to do so. D. This medication will help my eye restore intraocular fluid and increase intraocular pressure. The correct answer is this medication won't help my vision at all, but will keep it from getting worse. Glaucoma cannot be cured. Treatment revolves around preventing further deterioration. Question 42. A patient with glaucoma is verbalizing his daily medication routine to the nurse. He states he has 2 different eye drop medications. After waiting 1 minute with his eyes closed, he instills the other medication in the same way. What is the nurse's best response? A. You should wait more than 1 minute between different medications. B. Your routine is very good. Can you demonstrate it for me? C. It is actually not the best practice to close your eyes after instilling eye drops. D. You should actually be pressing your finger in the other corner of the eye. The correct answer is you should wait more than 1 minute between different medications. It is recommended to wait 10 to 15 minutes between different eye drop medications to prevent washout. Question 43. A nurse would evaluate which of these patients as appropriate candidates for a closed MRI without contrast, based on the information given? A 20-year-old woman who has unexplained joint pain and a low BMI. B. A 35-year-old woman with multiple sclerosis and has been trying to conceive. C. A 67-year-old man who has had an open heart surgery 4 years ago. D. A 40-year-old woman who has been in a hypomanic state for the last 2 days. The correct answer is a 20-year-old woman who has unexplained joint pain and a low BMI. The 20-year-old woman has no stated contraindications, pregnancy, metal implants, inability to lie still, for an MRI. Question 44. A nurse is caring for a patient in the cardiac care unit who is taking bumetanide, Bumex, and is diagnosed with Parkinson's disease. An unlicensed assistive personnel is assisting with feeding the patient. Which of these foods would the nurse stress for the patient to eat most? A. Foods containing the least amount of salt. B. Foods containing the most amount of potassium. C. Foods containing the most amount of calories. D. Foods containing the most amount of fiber. The correct answer is foods containing the most amount of potassium. Bumex is a loop diuretic that can cause hypokalemia. Dietary potassium is a priority to avoid electrolyte imbalance. Question 45. A nurse knows that which of these patients are at greatest risk for a developing osteoporosis? A. An 80-year-old man who has a thin build. B. A 48-year-old African American female who smokes cigarettes and drinks alcohol. C. A 55-year-old female with an estrogen deficiency. D. A 70-year-old Caucasian female who takes oral corticosteroids. The correct answer is a 70-year-old Caucasian female who takes oral corticosteroids. This patient has the most risk factors: age, female gender, Caucasian ethnicity, and corticosteroid use. Question 46. A 30-year-old Caucasian woman who works the night shift has been found to have early bone loss and has a high risk for osteomalacia. She asks the nurse exactly why she should take vitamin D supplements. What is the nurse's best response? A. It's a standard part of the overall nutritional treatment for the prevention of osteomalacia. B. It helps your intestines absorb calcium, which is important for bone formation. C. It stimulates skin cells to produce calcium, which is then released into the bloodstream to be used for bone formation. D. Vitamin D supplements should not be taken by someone of your age. The correct answer is it helps your intestines absorb calcium, which is important for bone formation. Vitamin D facilitates the absorption of calcium in the intestines, which is necessary for bone health. Question 47. A nurse is caring for a patient with a cast on the right leg. Which of these assessment findings would most concern the nurse? A. The capillary refill time is 2 seconds. B. The patient complains of itching and discomfort. C. The cast has a foul-smelling odor. D. The patient is on antibiotics. The correct answer is the cast has a foul-smelling odor. A foul-smelling odor is a sign of infection or a pressure ulcer beneath the cast. Question 48. A nurse is orally administering alendronate, Fosamax, a bisphosphonate drug. The patient is largely bedbound and being treated for osteoporosis. What nursing consideration is most important with administration of this drug? A. Sit the head of the bed up for 30 minutes after administration. B. Give the patient a small amount of water to drink. C. Feed the patient soon, at most 10 minutes after administration. D. Assess the patient for back pain or abdominal pain. The correct answer is sit the head of the bed up for 30 minutes after administration. Bisphosphonates cause esophageal irritation. Keeping the patient upright prevents esophagitis. Question 49. A nurse is asked by a patient to describe in layman's terms an overview of the condition called osteomyelitis. What would be the nurse's best response? A. Osteomyelitis is a gradual breakdown and weakening of your bones. It's most often age-related. B. Osteomyelitis is caused by not having enough vitamin D, which in turn causes your bones to be softer and demineralized. C. Osteomyelitis is an infection in the bone. It can be caused by bacteria reaching your bone from outside or inside your body. D. This is a question that should be directed to your healthcare provider. The correct answer is osteomyelitis is an infection in the bone. It can be caused by bacteria reaching your bone from outside or inside your body. Osteomyelitis is correctly defined as an infection in the bone. Question 50. The infection control nurse is assigned to a patient with osteomyelitis related to a heel ulcer. The wound is 5 centimeters in diameter and the drainage saturates the dressing so that it must be changed every hour. What is her priority intervention? A. Place the patient under contact precautions. B. Use strict aseptic technique when caring for the wound. C. Place another dressing to reinforce the first one. D. Elevate the patient's leg to prevent more drainage. The correct answer is place the patient under contact precautions. A patient with an uncontainable infectious wound must be placed on contact precautions to prevent spread. Question 51. A nurse in the emergency room receives a patient who had his left elbow fractured in a fight. His left hand has an unequal radial pulse, is swollen, and is numb and tingling. What is the nurse's priority intervention? A. Place the patient in a supine position. B. Ask the patient to rate his pain on a scale of 1 to 10. C. Wrap the fractured area with a snug dressing. D. Start in 4 in the other arm. The correct answer is start in 4 in the other arm. The patient has signs of compartment syndrome. Starting in 4 is the priority to prepare for potential emergency surgery, fasciotomy. Question 52. A nurse is caring for a female patient 24 hours after a hip fracture. The patient is on bed rest. The nurse knows that which regular assessment or intervention is essential for detecting or preventing the complication of fat embolism syndrome. A. Performing passive, light, range of motion exercises on the hip as tolerated. B. Assess the patient's mental status for drowsiness or sleepiness. C. Assess the pedal pulse and capillary refill in the toes. D. Administer a stool softener as ordered. The correct answer is assess the patient's mental status for drowsiness or sleepiness. Decreased level of consciousness, drowsiness, is often the earliest sign of fat embolism syndrome due to hypoxia. Question 53. What is the overarching nursing concern when caring for patients being treated with splints, casts, or traction? A. To assess for and prevent neurovascular complications or dysfunction. B. To ensure adequate nutrition during the healing process. C. To provide patient education for maintenance of splints, casts, or traction in the community. D. To treat acute pain. The correct answer is to assess for and prevent neurovascular complications or dysfunction. Preventing neurovascular dysfunction, damage to nerves and blood vessels, is the priority diagnosis. Question 54. What nursing action demonstrates the nurse understands the priority nursing diagnosis when caring for patients being treated with splints, casts, or traction? A. The nurse assesses extremity pulse, temperature, color, pain, and feeling every hour. B. The nurse orders meals with adequate protein and calcium for the patient. C. The nurse teaches the patient never to insert objects under a cast to scratch an itch. D. The nurse administers oral painkillers as ordered. The correct answer is the nurse assesses extremity pulse, temperature, color, pain, and feeling every hour. Frequent assessment of the 6 Ps, pulse, pallor, pain, paresthesia, paralysis, poikilothermia, addresses the risk for neurovascular dysfunction. Question 55. A patient is admitted and complains of gastric pain, fever, and diarrhea. Which assessment finding should be reported to the healthcare provider immediately? A. Abdominal distension. B. A bruit near the epigastric area. C. 3 episodes of vomiting in the last hour. D. A blood pressure of 160/90. The correct answer is a bruit near the epigastric area. A bruit in the aortic area signals the presence of an aneurysm, which is life-threatening. Question 56. The nurse in the day surgery center cares for a patient who has undergone an endoscopic procedure with general anesthesia. The nurse understands that which nursing consideration is a priority immediately after an endoscopic procedure? A. Raise the side rails of the patient's bed. B. Do not offer fluids, food, or any oral intake. C. Check the temperature of the patient. D. Teach the patient to avoid aspirin or NSAIDs. The correct answer is do not offer fluids, food, or any oral intake. Anesthesia inactivates the gag reflex. The patient must remain NPO until the reflex returns to prevent aspiration. Question 57. A nurse is preparing to palpate and percuss a patient's abdomen as part of the assessment process. Which of these findings would cause the nurse to immediately discontinue this part of the assessment? A. The patient states that sounds like it might hurt me. B. There is a pulsating mass on the upper middle abdomen. C. The patient has black, tarry stools and anemia. D. The patient has had an endoscopic procedure 2 days prior. The correct answer is there is a pulsating mass on the upper middle abdomen. A pulsating mass indicates an aortic aneurysm. Palpation could cause a rupture. Question 58. A nurse understands that which of these patients are at risk for developing oral candidiasis, a type of stomatitis? A. A 77-year-old woman in a long-term care facility taking an antibiotic. B. A 35-year-old man who has had HIV for 6 years. C. A 40-year-old man who is undergoing chemotherapy. D. An 80-year-old woman with dentures. The correct answer is a 77-year-old woman in a long-term care facility taking an antibiotic. Antibiotics can destroy normal flora, leading to fungal overgrowth. This patient has multiple risk factors: age, antibiotics, LTC. Question 59. What nursing intervention demonstrates that the nurse understands the priority nursing diagnosis when caring for oral cancer patients with extensive tumor involvement and/or a high amount of secretions? A. The nurse uses a pen pad to communicate with the patient. B. The nurse provides oral care every 2 hours. C. The nurse listens for bowel sounds every 4 hours. D. The nurse suctions as needed and elevates the head of the bed. The correct answer is the nurse suctions as needed and elevates the head of the bed. Ineffective airway clearance is the priority diagnosis. Suctioning and positioning helps maintain the airway. Question 60. A patient has been taking a mood-stabilizing medication, but is afraid of needles. They ask the nurse what medication would not require regular lab testing. What is the nurse's best response? A. Valproic acid, Depakote, B. Clozapine, Clozaril, C. Lithium D. Risperidone, Risperdal. The correct answer is risperidone, Risperdal. Risperidone is an antipsychotic/mood stabilizer that typically does not require the therapeutic blood level monitoring that lithium or valproic acid do. Question 61. A patient is deciding whether they should take the live influenza vaccine, nasal spray, or the inactivated influenza vaccine, shot. The nurse reviews the client's history. Which condition would not contraindicate the nasal, live vaccine, route of administration? A. The patient takes long-term corticosteroids. B. The patient is not feeling well today. C. The patient is 55 years old. D. The patient has young children. The correct answer is the patient has young children. Having young children is not a contraindication for the live vaccine unless the children are severely immunocompromised. Question 62. A patient asks the nurse whether he is a good candidate to use a CPAP machine. The nurse reviews the client's history. Which condition would contraindicate the use of a CPAP machine? A. The patient is in the late stage of dementia. B. The patient has a history of bronchitis. C. The patient has had suicidal gestures/attempts in the past. D. The patient is on beta blockers. The correct answer is the patient is in the late stage of dementia. CPAP requires the patient to be able to follow commands and maintain the equipment. Late stage dementia makes this impossible. Question 63. The nurse is caring for a patient who has recently had a successful catheter ablation. Which assessment finding demonstrates a successful outcome of this procedure? A. The patient is free of electrolyte imbalances. B. The patient's WBC count is within normal limits. C. The patient's EKG reading is regular. D. The patient's urine output is 45 ml/hour. The correct answer is the patient's EKG reading is regular. Catheter ablation is used to destroy conduction fibers causing arrhythmias. A regular EKG indicates success. Question 64. Application. The nurse is caring for a patient who has the following labs: creatinine 2.5 mg/dl, WBC 11,000 cells/ml, and hemoglobin of 12 g/dl. Based on this information, which of these orders would the nurse question? A. Administer 30 units of Lantus daily. B. CT of the spine with contrast. C. X-ray of the abdomen and chest. D. Administer heparin subcutaneous 5,000 units every 12 hours. The correct answer is CT of the spine with contrast. Creatinine of 2.5 indicates renal impairment. Contrast dye is nephrotoxic and contraindicated. Question 65. Application. A nurse is caring for a patient admitted in the emergency room for an ischemic stroke. The physician is considering the use of fibrinolytic therapy with TPA. Which history gathering question would not be important for the nurse to ask? A. What time was the first time you noticed symptoms appearing consistently? B. Have you been taking any blood thinners like heparin, Lovenox, or warfarin? C. Have you had another stroke or head trauma in the previous 3 months? D. Have you had any blood transfusions within the previous year? The correct answer is have you had any blood transfusions within the previous year? Blood transfusions do not contraindicate TPA use, whereas time of onset, anticoagulant use, and recent trauma do. Question 66. A patient is being discharged from the med-surgical unit. The patient has a history of gastritis. The nurse questions the patient on his usual routine at home. Which of these statements would alert the nurse that additional teaching is required? A. I avoid NSAIDs. I only take a daily aspirin for my heart health. B. I always avoid eating hot and spicy foods. C. I will continue taking my antacids with or immediately after meals. D. I will only drink coffee once a week, if even that often. The correct answer is I avoid NSAIDs. I only take a daily aspirin for my heart health. Aspirin is an NSAID and irritates the stomach lining. It should be avoided by patients with gastritis. Question 67. A nurse is meeting a patient in their home. The patient has been taking naproxen for back pain. Which statement made by the patient most indicates that the nurse needs to contact the physician? A. I get an upset stomach if I don't take naproxen with my meals. B. My back pain right now is about a 3/10. C. I get occasional headaches since taking naproxen. I have ringing in my ears. The correct answer is I have ringing in my ears. Ringing in the ears, tinnitus, is a sign of NSAID/salicylate toxicity. Question 68. The nurse is doing an intake screening for a patient with hypertension. They have been taking Ramipril for 4 weeks. Which statement made by the patient would be most important for the nurse to pass on to the physician? A. I get dizzy when I get out of bed. B. I'm urinating much more than I used to. C. I've been running on the treadmill 10 minutes each day. D. I can't get rid of this cough. The correct answer is I can't get rid of this cough. A persistent dry cough is a common adverse effect of ACE inhibitors like Ramipril and often requires switching medication classes. Question 69. The nurse in the emergency room sees a patient who has been abusing alprazolam, Xanax. The patient reports that he suddenly stopped taking Xanax about 24 hours ago. Which of these intervention takes priority? A. Have the patient lie down on a stretcher with bed rails up. B. Give the patient a cup of water to drink and a small amount of food. C. Assure the patient that he will be okay. D. Alert the physician that the patient needs Xanax. The correct answer is have the patient lie down on a stretcher with bed rails up. Benzodiazepine withdrawal can cause life-threatening seizures. Seizure precautions, lying down, padded rails, are the priority. Question 70. A nurse cares for a child that is diagnosed with hepatitis A. Which of these following precautions would be most important to take to prevent transmission of this infectious disease? A. Encourage the hepatitis A vaccine for family members and siblings. B. Use needleless systems if possible, otherwise use careful needle precautionary measures. C. Teach the child and enforce strict and frequent hand washing. D. Teach the child and family the dangers of contaminated food and water. The correct answer is teach the child and enforce strict and frequent hand washing. Hepatitis A is transmitted via the fecal-oral route. Hand washing is the most effective prevention. Question 71. A nurse is treating a patient suspected to have hepatitis. The nurse notes on assessment that the patient's eyes are yellow-tinged. Which of these diagnostic results would further assist in confirming this diagnosis? A. Decreased serum bilirubin. B. Elevated serum ALT levels. C. Low RBC and hemoglobin with increased WBCs. D. Increased blood urea nitrogen level. The correct answer is elevated serum ALT levels. ALT is a liver enzyme. Elevated levels indicate liver damage consistent with hepatitis. Question 72. Which of these patients would the nurse suspect as having the greatest risk of contracting hepatitis B? A. A sexually active 45-year-old man who has type 1 diabetes. B. A 75-year-old woman who lives in a crowded nursing home. C. A child who lives in a country with poor sanitation and hygiene standards. D. A sexually active 23-year-old man who works in a hospital. The correct answer is a sexually active 23-year-old man who works in a hospital. Hepatitis B is transmitted through blood and body fluids. This patient has occupational risk, hospital, and behavioral risk, sexual activity. Question 73. The nurse calculates the flow rate of a patient receiving lactate ringers solution. The patient is to receive 2000 ml of lactate ringers over 36 hours. The 4-infusion set has a drop factor of 15 drops per milliliter. The nurse should set the 4 to deliver how many drops per minute? A. 8B, 10C, 14D, 18. The correct answer is 14. 2000 ml asterisk 15 GTT slash ml forward slash 36 hours asterisk 60 minutes equals 30,000 slash 2,160 equals 13.88, rounded to 14 GTT slash min. Question 74. The nurse calculates the flow rate of a patient receiving an antibiotic. The patient is to receive 100 ml of the antibiotic over 30 minutes. The 4-infusion set has a drop factor of 10 drops per milliliter. The nurse should set the 4 to deliver how many drops per minute? A. 11B, 19C, 26D, 33. The correct answer is 33. 100 ml asterisk 10 GTT slash ml slash 30 minutes equals 1000 slash 30 equals 33.33, rounded to 33 GTT slash min. Question 75. Which of the following statements made by a client during an individual therapy session would the nurse most identify as reflecting schizoaffective disorder? A. I just want to stab myself with this pen. B. What's the point in life anyways? C. My thoughts are racing because of the conspiracies against me. D. I hear voices every day and sometimes see old friends that don't exist. The correct answer is my thoughts are racing because of the conspiracies against me. Schizoaffective disorder combines mood disorder symptoms, racing thoughts/mania, with schizophrenia symptoms, paranoia/delusions.